Cardiovascular disease or coronary artery disease, in truth, is nothing more than a toothless paper tiger that need never ever exist. And if it does exist, it need never ever progress. So that's a pretty strong statement, but it's really quite exciting when you think about the fact that we've known for many, many, many years that there were multiple cultures throughout the planet Earth where cardiovascular disease was virtually non-existent 100 years ago. Rural China, Central Africa, the Tarahumara Indians in northern Mexico, uh, Okinawa, and the Papua Highlands in New Guinea. Now, as they have westernized, of course, some of those countries now are seeing heart disease. But if we take lessons from what we've learned from them in the era when they did not have heart disease, it can be very profound to think that without any gadgets, without any expensive drugs that are going to give side effects, with no surgical interventions, we can eliminate this disease with food. We treat the disease with, when I say that, I mean New Zealand, Australia, Europe, United States, South Africa. We treat heart disease with drugs, stents, and bypass operations, none of which have one single solitary thing whatsoever to do with the causation of the illness.
Basically, we treat the symptoms and not the cause.
What I try to share with patients is they have to understand as best they can the mechanism of causation. So all experts would agree that where this disease has its inception, its onset, its progression is is when we injure that delicate innermost lining of the artery called the endothelium. And it is the endothelium that is responsible for making a truly magic molecule of gas called nitric oxide. And it is the nitric oxide that is responsible for the salvation, preservation, and protection of all of our blood vessels because of its remarkable functions. For example, nitric oxide will keep all the cellular elements within our bloodstream flowing smoothly like Teflon rather than Velcro. It keeps things from getting sticky. Number two, nitric oxide is the strongest blood vessel dilator in the body. When you climb stairs, when you climb stairs, the arteries to your heart, the arteries to your legs, they widen, they dilate. That's nitric oxide. Number three, nitric oxide will protect the wall of the artery from becoming thickened, stiff, or inflamed and protect us from getting high blood pressure or hypertension. Number four is the absolute key. A safe and normal amount of nitric oxide will protect us all from ever developing blockages or plaque. So literally, when you think about it, everybody on the planet Earth who has cardiovascular disease has their disease because in the previous decades, they have so sufficiently trashed, injured, compromised, and turned their endothelial system into an absolute train wreck that they no longer have enough nitric oxide to protect themselves from making blockages and plaque. However, the good news is this is not a malignancy. It is a completely benign foodborne illness that need never, ever progress. And once you can get patients to understand that never, never, ever, ever again are they to pass through their lips a single morsel that is going to further injure an already train-wrecked endothelium, because then the endothelium will recover, make enough nitric oxide so we can not only halt disease, but we often will see elements of disease reversal. Now, what are the foods that every time they pass our lips, we injure the endothelial cells? They are, one, any drop of oil, olive oil, corn oil, soybean oil, safflower oil, sunflower oil, coconut oil, palm oil, oil in a cracker, oil in a chip, oil in a piece of bread, oil in a salad dressing. We want to eliminate oil. Also, we want to get rid of animal protein, meat, fish, chicken, fowl, turkey, and eggs. Also, we want to get rid of dairy, milk, cream, butter, cheese, ice cream, ice cream, and yogurt. And we want to get rid of sugary foods, excuse me, sugary drinks, diet, Coke, Pepsi. We want to get rid of sugary foods, cakes, pies, cookies, stevia, agave, and, excuse me, and maple syrup and honey. And we want to get rid of peanuts, peanut butter, nut butters, cashew sauce, and avocado. And lastly, coffee with caffeine. Decaf, yes. Black tea, yes. Green tea, yes. Now we want to know what you're going to eat. You're going to eat all these marvelous whole grains for your cereal, bread, pasta, rolls, and bagels. 101 different types of legumes, lentils, and beans. All these marvelous red, yellow, and green leafy vegetables, white potatoes, sweet potatoes, and some fruit. Now, I should share with you that it was about a decade ago that I made a major change in the program. And that was out of recognition of the fact that the endothelial production of nitric oxide is age dependent. For example, you never you never heard of a boy or a girl having a heart attack at age 8, right? No, they have nitric oxide coming out of their ears. But by the time they're beautifully healthy, at age 50, they now have 50% of the nitric oxide they had when they were age 25. And by the time they're 80, by the time they're 80, they've lost 70%. So the changes I made were two. One was a greater stimulation of the endothelial production of nitric oxide. And number two, we embraced. We embraced the newer research that shows us that mankind has an alternate pathway for making additional nitric oxide. So here we go. I need you as a patient to choose 6 times a day a green leafy vegetable, roughly the size of 1/3 of a cup after it's first been steamed or boiled 5.5 to 6 minutes so it's now nice and tender. And then you must anoint it with several drops of a delightful either balsamic or rice vinegar. Why? Because research has shown us that the acetic acid in those vinegars can restore the nitric oxide synthase enzyme, which is found within the endothelial cell and is responsible for making nitric oxide. So you're going to chew this alongside your breakfast cereal, again as a mid-morning snack, again with your lunch and sandwich. That's 3. Mid-afternoon, 4. Dinner time, 5. And of course, I adore it when you have that evening snack of arugula or kale. Now, the second benefit, when you're chewing the green leafy vegetable, you restore the capacity of the bone marrow to make the endothelial progenitor cell, which will replace our senescent, injured, worn out endothelial cells. The third benefit, when you're chewing the green leafy vegetable, you are chewing the green nitrate. As you chew the green nitrate, they are going to mix with the facultative anaerobic bacteria that reside in the crypts and grooves of your tongue. Those bacteria reduce the nitrates you've been chewing to nitrites. When you swallow the nitrites, it is your own gastric acid, which further reduces the nitrites to more nitric oxide, which enters your nitric oxide pool. So think about it. What you're doing for absolutely minimal expense, no side effects, all day long, dawn to dusk, morning to night, you are absolutely restoring nitric oxide, the very molecule, the deficiency of which has given you this disease in the first place. Now, there is a caveat to this, and that caveat is that toothpaste with fluoride, public drinking water with fluoride, and mouthwash will injure the beneficial bacteria, and you will be unable to process into the nitric oxide. Now, I do not like antacids. Why? Because antacids will decrease your gastric acidity, and you will be unable to reduce the nitrites to more nitric oxide. And I should share with you that the top six would be kale, Swiss chard, spinach, arugula, beet greens, and beets. Now, what I've just shared with you is something that I go through in detail with every single patient. It's so important that they get their arms around this whole concept of the endothelial cell and nitric oxide because it takes all the mystery away from them. Because so many people with heart disease who've had a heart attack are waiting for the other shoe to fall. And they absolutely, you can almost see them in tears to think that they now suddenly realize that they themselves created this disease and we are empowering them as the locus of control to halt and reverse this disease. And so that's really what I've just shared with you, my concept of how this disease has its inception, its causation. And it's so exciting to think that something such a horrible disease is so ridiculously simple to absolutely eliminate.
I have a group of people that I help every month to get back on eating unprocessed foods and to help them realize that eating 6 servings of greens is not a big deal because what you just said is that it's about a third of a cup, correct? And when you tell people that they need to eat about 6 servings, they get kind of this horrifying face because they think they're going to eat these mountains of greens. And as long as the body is bathed, as you put it, our arteries are bathed with nitric oxide with these 6 times a day. And it's a small amount, correct? You said about a third of a cup.
Yeah, if that's too much, they can always back off a little bit. But
I
once you
just
once you've steamed it and boiled it, it really shrinks pretty much.
I just find it so easy. I mean, I know I eat more than 6 because it's a small amount, and since I love to cook my own beets, I have beets there in the kitchen counter, and every time I go by, I eat a slice, and it's so easy to do that with a few techniques. Okay, so you're still seeing patients at the clinic?
Well, not I, physically. I'm not at the clinic, but I do it through often through my contract is with a clinic, but I do it from home.
Oh, okay. All right. Very good. Very
Because
good.
we do it virtually.
Question because someone asked it here. And of course, I always eat arugula cold, I mean raw, because I put it in a salad. But arugula can be cooked, correct? Or am I?
Yeah, I usually eat it raw.
Yeah. So it doesn't matter if, or does it matter if some of those 6 servings, maybe 1 or 2 of those 6 servings is raw, or would you say that the 6 servings are lightly steamed, and then anything extra you get is extra benefit if you're eating something raw?
Yeah, I think that's fine.
Yeah. Okay. Very good. Can you do explain a little bit? Someone here is asking if you could elaborate on why not stevia.
There is data, and I can't remember the source, that it would indicate that both stevia and agave, which are manufactured, have some contribute some injury to the cardiovascular system.
Okay. All right. Okay. Now, when you're talking about with all that you've mentioned so far, does that apply to someone who has a serious heart disease, or someone who doesn't have heart disease. Of course, everybody who doesn't have, who has heart disease now at some point didn't have it, and of course they with the food they ate and lifestyle they basically arrived there. But what are your thoughts?
No, I think you've hit it on the head. When I started this years and years ago, I remember we would try to differentiate people did not have heart disease and people who do have heart disease, and saying, well, but as you begin to think more deeply into this entire causation of endothelial injury, a lack of nitric oxide, you look at these studies. I'm thinking of one now from 1999, where the study looked at young women and men between the ages of 17 and 34 who had died of accidents, homicides, and suicides. And at autopsy, the study showed that early coronary artery disease in these young men and women was ubiquitous. Everybody. And of course, when you think about it, with everybody having a start of this disease in their late teens and early 20s, it's no great surprise that by the time we get into the late 40s and 50s, we begin to see this tsunami of cardiovascular disease. So
Mhm.
you have to say to yourself, if I were some sort of king and I could mandate that everybody in my kingdom can never get heart disease and everybody in my kingdom must eat plant-based,
Right.
there would be no heart disease. Now, we can't do that, but I think it's important philosophically and really, quite honestly, we have to accept the fact that are we intellectually, is it totally honest of us not to say that those people really should start early, and in other words, to prevent themselves from ever having heart disease? When is it correct to say you can eat the Western diet until you're about to have a stroke
Right.
or you're about to have your first heart attack? Uh, I think that philosophically that becomes very challenging. And when you think about it, we're not asking people to do some penance or undergo some horrible transition. What we're simply getting people to do is to abandon abandon one pile of delicious food that is guaranteed to destroy them for another pile of delicious food that literally guarantees that they can protect themselves forever from getting heart disease. And I think you have to sort of philosophically take that into consideration when you make these recommendations. I have a chapter in my book entitled Moderation Kills. For instance, let me give you an example of I had not long ago, I was counseling a couple where the husband had had a heart attack. I got through going through what I've just said, and the wife asked me, Dr. Esselstyn, you haven't described for us yet what are the cheat days? And I said, the cheat days? You mean if your husband is careful through the week that on Saturday and Sunday he can eat what he wants? Yeah, that's what I'm talking about. And I said, do you realize that what you just said is what you're doing? Is it that is 2 days of the week or over 104 days of the year, you're asking your husband to consume foods that are going to guarantee he is going to have another heart attack. Oh, Dr. Esselstyn, I didn't think of it that way.
But it is that way. Yeah, it is. And I can see here in your book, that's chapter 5, where it says moderation kills. And of course, when you put it, when you add up the dates, yeah. Actually, talking about dates, Dr. Esselstyn, there is, we can come back to this topic that we're discussing now. I received a large number of questions on one special topic, and it's a little bit controversial, I guess, because nobody seems to agree. And so the topic is this, that there are a lot of people that follow your book and what you recommend, and they strive to follow the protocol as precisely as possible, and they say that they strive for not having more than 3 fruits per day. And then the question is, okay, a very ripe banana has around 15 grams of sugar, and the same is found in a serving of 43 raisins, and the same is found in one average medjool date, 15 grams of sugar. Yeah. So instead of the 3 bananas, is it safe to substitute 3 dates or 3 servings of raisins? We like to use dried fruits, they say, in occasional sauces and in the rare dessert for a birthday. So the question is, do dates injure endothelial cells?
Well, I think sugar does. It's so concentrated in a date when you think about, look, well, look, what we're going to have to say here is, look, if you're a patient with heart disease, the dates are out. If you don't have heart disease, again, you're occasionally going to have something that's sweet. Be reasonable about it, but because if you have a 1 date a month or 1 date a week, who knows? That's probably going to be safe. But as far as having, I think the thing that we want to get across here is not to argue about dates so much as it is for patients who have heart disease and even those who don't know that sugar injures endothelial cells.
Correct, correct. But now the question is also, is sugar, like white sugar, processed sugar, table sugar, the same as sugar in a fruit or in a date
I
or?
haven't seen a good study that differentiates that.
Oh, okay. Interesting. Okay. Is there a difference between a
It,
fresh fruit and dry fruit?
dried fruit is just pure sugar. And I
Uh,
absolutely want patients not to have dried fruit.
uh,
You have to remember, Gustavo, the reason that my program succeeds where others fail, nobody else is as mean as I am.
That's right. Well, we're talking about life and death here. Okay, this is serious business. So you have all the right to be mean, although you don't seem mean. Although your son Rip in last week's interview, he said that when he was called to your office, that meant that he was in trouble. So anyway, okay. Well, I think we got the answer that many people were looking for, and it could be dates, it could be any kind of dry fruit, but they're high in sugar, and if you have if heart disease, that's probably not the safest thing to eat. Correct?
You're correct.
Okay, very good. All right. So, is there a way that people can, a protocol where people could become your patient, or how does that work?
Well, I'm a little bit old-fashioned.
Uh-huh.
The way it works today, I don't see patients personally. It's almost all
Yeah, online.
virtual, and all I have to do is call my office or my secretary will put me in touch, and we take it from there. I
Oh,
uh, I don't usually, since I'll have to be honest and tell you that probably every patient who seems to call me already has a doctor at home, and they've just somehow gotten interested, or they've gone to the internet and they've learned a little bit more about the disease, and perhaps they've seen comments about disease reversal where my name comes up, or they may have seen the movie Forks Over Knives where I was involved, or maybe from word of mouth. But no matter, if they call my secretary, and I'm a little old-fashioned, and I insist that I speak to every one of the patients individually. Now, inasmuch as almost always they have a doctor at home, the last thing that I ever want to do is to drive any kind of a wedge between that patient and their doctor at home. And so the doctor at home often will have this patient already on medication, which is fine. I'm not going to change the medication, but what seems to happen and works for the best of both worlds, after the patient leaves our and is now on our program, and they get back and their doctor at home sees them and they say, "Oh my goodness, your cholesterol has dropped. We're going to have to reduce or stop your cholesterol medication. Oh my goodness, your high blood pressure is really coming under control. We're going to have to reduce that medication as well." And so it's really kind of fascinating that also they might find that suddenly your cholesterol is plummeted. We're going to have to reduce or eliminate your cholesterol medication. In this way, we do not interfere with the relationship that the doctor has with their patient, and they're making a very sensible alteration of their drugs. And in doing this over the last 40 years, I have yet to receive a single email or phone call from a patient's doctor saying, "Dr. Esselstyn, how dare you teach my patient the healthiest diet on the planet?"
correct. There is, yeah, cannot say that.
Right now, I'm very happy with the results that we're getting, and I'm not going to apologize for being what some people may refer to as strict. But
Uh-huh.
strict simply means I'm asking you to eat in a way that is not hurting yourself. If you're a patient who wants to hurt yourself more, I don't have control over that. Yeah. It's very exciting when patients grasp and get their arms around the etiology, the causation of this disease. It really is empowering them. And they suddenly feel, "Oh my God, why would I ever want to eat anything that's going to make this disease worse? I've been told how to do this. We've shown them how to do this. They can go to the internet. They can go to our website. They can see the scientific papers that we've written, and so forth. But and I'm sure that as things progress, there are going to be people who will have a successful diet that will show that maybe there are one or two or three or four or more things that I don't let people have that you could have a little bit of, but I don't apologize for that right now. Right now, we're at a point where we got a winner, and we want to keep it that way until we've got hard scientific data that can be modified and still be successful.
Right. Always going with the science has that's always been my motto, and of course, you as a physician too. And now talking to on the other end of the spectrum, what about the use of salt with heart disease patients?
Yeah, I think patients with heart disease, the last thing we want them to have is hypertension. And so we're really very cautious about having salt. I don't know that salt Well, let me back that up just a little bit. If somebody's eating the food that is just too bland for them, if they take a salt shaker, the amount that you get from a salt shaker is so minimal that you can improve the taste of your food with it, just but not cooking with it, not cooking with it.
Lemon, vinegar.
Yeah, there are other. My wife is saying there are other things like lemon and vinegar and so forth.
Right, right. That give the impression that you have
Yes.
saltiness.
Salt is not a health food.
It's not a health food, correct? Okay. Well, very good. All right. So, um, thinking about 20 or 30 years ago when you wrote the book, are you treating patients, heart patients, the same way today as you did before, or are
No,
any other changes?
no, I didn't. I didn't really. When I started this in 1985, we had nitric oxide hadn't even been or discovered. Remember, uh, it was Furchtgott, Murad, and Luignaro were the three scientists who, in 1988, discovered nitric oxide. So that the way I was dealing with patients before we had even that discovery was simply trying to have them eat as closely as they could to what we were seeing in those countries and those cultures that were eating plant-based. So in other words, I think fortuitously, by eliminating those foods, but we improved their endothelial cells because we were seeing disease reversal even in the early days. So, obviously, so I'd have to say that one of the major changes I made were when a decade ago, when we really began appreciating the importance of nitric oxide, and that's when we had patients begin to 6 times a day do the green leafy vegetables because it really was literally restoring. All day long, you're restoring the very molecule, the deficiency of which has been giving you this disease.
Correct, correct. Okay, so that has been an improvement or a change, we could say, when the nitric oxide was actually discovered and you introduced these 6 servings of greens in the program, right?
Yeah, in 1998, those three men got the Nobel Prize
Yeah, yeah, they did.
for
Very good.
discovering nitric oxide. Yeah.
Yeah. And you have mentioned it several times, and I still get people who love smoothies. I never really got into it, so for me it's not an issue, but a lot of people really enjoy smoothies. And so they quote studies here and there that it's the same thing to uh, have your greens in a smoothie as it is chewing. But that's not according to you, who, of course, and the science that say that we need to really chew the greens. Can you explain a little more on that?
Well, I think that a couple of things here. One, I have no problem with people eating a banana, an apple, an orange as grown, because
Uh-huh.
when you eat it that way, the fructose, which is bound to fiber, the absorption is slow and safe. When you beat it up, and when you take a smoothie which is a green, it's fine. But because it's a little bitter, people will want to add fruit to it. So they add an apple, an orange, a banana. And then you beat it up and you separate the fructose from the fiber. So now when it goes into your stomach, it goes off like a rocket, injures the liver glycase protein and injures the endothelial cell. So I've been a little cautious about that. Now, there's one other thing that escapes me I wanted to say about, uh, I think it was about the smoothie. Oh, well, yes. There seems to be a growing opinion that when you chew Right? In other words, when you chew rather than a smoothie, when you're chewing the green leafy vegetables, it takes advantage not only of the disruption of the cells of the green leafy vegetable when you're with your teeth, but when you do this, you also are making it so that it is exposed to all the beneficial enzymes that are in the mouth, which are completely bypassed if you just do it as a smoothie. So I can be persuaded otherwise if I saw the hard data that it would be safe to do this, but I'm just trying to explain the rationale
Right.
behind.
Okay. Okay. Yeah. It's just that, some people are commenting here, and for the just everyday people that maybe don't have a background on medicine or reading studies, that there are studies that pro can prove anything. And so, there are studies that say, yeah, eat all the eggs you want. There are studies that say, you can create a study to prove just about anything you want. So the confusion that people have with all of these studies that are contradicting is monumental. What would you suggest that there a website, or is there a group of doctors that they should listen um, to avoid this great confusion out there?
I think one of the reasons that we've been able to get the word across is that it's very powerful when you look at all the elements of that we've shown of disease reversal. Reversal of the PET scan, reversal of the stress test, reversal of carotid disease, reversal of coronary artery disease. These are all documented by angiography. The PET scan is obviously also a different way of documenting it, but it's very powerful. And then, of
Mm-hmm.
course, you get rid of the symptoms of erectile dysfunction, angina, and so forth. And it can be very persuasive when you've published this in peer-reviewed scientific literature that this is not hype or snake oil. You've got evidence that you can halt disease progression, and we've shown time and again evidence of disease reversal.
Would you comment on menopausal women's cholesterol that can be high and difficult to control? Is there a correlation there?
Well, the only comment that I would have about that is that it's probably I wouldn't get tied up in knots worrying about the cholesterol and menopause because no matter what's happening, if they are eating whole food plant-based nutrition as we've discussed, uh,
Mhm.
not only will the menopausal symptoms probably be improved, but they still are protected. I think it was John McDougall. No, it was Neil Barnard who showed how as a matter of fact, I think it's the Japanese who they do not even have a word for hot flash.
Right, exactly. Yeah, yeah, that's true. And why is that? Could that be because of the food?
Well,
And life?
probably yeah, because and also I think they do not have a lifetime of higher estrogen. But it's in this country when you have the high estrogen and then you suddenly go through menopause and the high estrogen suddenly is gone. Those are the women that apparently have the most symptomatic symptoms.
Right, right. So one of those, the patients that you see virtually, as you explained earlier, how many pieces of fruit are you allowing them to have, or is it all the fruit that they want every day?
Well, there is data to suggest that you could eat. There are some people called fruitarians, and
Correct.
they eat food all day and they're fine. I'm a little bit hesitant to go quite that far. So I think when people have at least, they can have more than 3 pieces of fruit a day, providing that there's their their data indicate that it's not too much for them. Yeah, I don't think I cannot tell you that 3 pieces of fruit is going to hurt anybody. But on the other hand, if they want to go up to 6 pieces of fruit a day, I think that's fine, providing that their lipid pattern isn't going too far astray.
Okay. All right. Very good. Well, Dr. Esselstyn, we've taken a lot of time from you today in your busy schedule. So if you could give one message to people who want to protect their hearts and arteries for the rest of their lives, what would that be?
The reason I'm so involved with this at my age, I really I see this whole approach to eliminating cardiovascular disease. This is what we would think of as really a seismic revolution in health. And this seismic revolution in health will never come about through another drug, another stent, or another bypass. The seismic revolution in health will come about when we have the will and the grit and the determination to share with the public what is the lifestyle, and most specifically, what is the nutritional literacy that will empower them to absolutely eliminate chronic disease.
Thank you again for your very, very wise words. And I don't know if Anne is there near you, but would
Sure,
like,
yeah.
can she say too?
Anne wants to say hello.
If she wants to. No, it's okay. Maybe she wasn't prepared, so that's all right. But I wanted to thank her for choosing that beautiful jacket that she chose for you today, that I love the color.
Me too.
How are you? And we always love to see your videos that you do with your daughter. They're so fun and inspiring. Thank you for doing that.
Thank you for spreading the word.
Yes.
That's important.
All right. So very good. Well, thank you.
Also, thank you for being John McDougall's great helper.
Yeah, yeah. Well, that was one of the greatest gifts that life gave me, to be able to work with him and for him, and I miss him tremendously. But we all have the legacy, and we must keep on changing the world. So, and you are doing it. So, thank you. Do you have any questions? Do you have any last words, and that you'd like to share with, especially with women and women's health? I mean, how, anything you want to share?
Eat breakfast. Eat 3 meals a day and try and avoid eating in between meals, unless you're some kind of special athlete you're training.
I like that. I like that you say that, because that's what I preach. It's like, eat the 3 meals, try to avoid snacks, because we've gotten in the last few decades used to eating snacks, and these snacks add up to another meal.
And where does the snack end if you're having crackers? Do you finish the box? Where does a snack end?
Well, it ends when the box is empty. That's
Yeah.
That's why I don't keep them, because I really have my addiction, I guess I could say, a weakness is anything that's flour. So I try to really.
Well, my only regret today is that we didn't hear you on the piano.
Oh yeah, well, I would love to. We'll have to do it one of these days.
How old were you when you started taking piano lessons?
Oh, so now I'm being interviewed. Okay. Yeah, no, I was 80 years old and I'm 62. So it's is more than half a century of being a musician, and life has been with me all my life. And I'm going to be in Cleveland in May. So I think I might give a concert there. I don't know. I'll let you know.
Congratulations. That's
Yeah.
great.
Thank you.
Okay, well, thank you, everybody. I really appreciate it. Let's see, Gustavo, question for you. Where do you recommend eating? Oh, okay. Well, I can answer that by email. Okay. Thank you one more time, Dr. Esselstyn and Anne, for making this possible. And I hope that we can see each other in the near future. Bye-bye, everyone.
Bye-bye.